Hello and welcome. I'm a patient with obstructive sleep apnea, and I'm here on behalf of the European Lung Foundation. I'd like to introduce Dr. Joerg Steier, who is going to give some information about the latest sleep research and give us some upcoming information.
Thank you very much and welcome.
So positive airway sleep pressure treatment such as CPAP, we know it's the gold standard treatment, but are you able to tell us about some recent research that highlights its benefits?
Yes, thank you, Lucy. So for many years, we have seen that with CPAP therapy, you can normalize the breathing and that symptomatically patients improved. What we were lacking so far was really the evidence that also with the relief of the stressful breathing at nighttime, any cardiovascular long-term risk may normalize. And there was last year in the Lancet Respiratory, the analysis of a group that looked after more than 1 million patients over a long-term follow-up, analyzing many data points from different studies, proving that the cardiovascular risk and the overall mortality in patients who use CPAP therapy actually improves drastically. This is also directly related to how long you use the treatment at night. The longer, the better. If you use CPAP therapy just for a part of the night, the effect will be less significant. And if you use it for all night long, it will be more significant. So this was really the first time that it could be shown that mortality and particularly cardiovascular mortality can be improved with patients with OSA if we use CPAP therapy.
Okay, so that's all about adherence.
Yes, indeed. So it's about the efficacy of the treatment and adherence. And as always, it makes it fairly important to stress that it does matter whether you use it at all, and if so, for how long.
Was there any information about CPAP therapy on blood pressure?
Yes, thank you. There is actually an international collaboration. It's called the Andante collaboration, which tried to pool any data there was from randomized controlled trials, from highly designed evidence-based studies, looking at all the interventions that used CPAP therapy in sleep apnea patients and pool together the data and outcomes. And what they found and published over the course of last year was that, yes, it does matter whether you use CPAP therapy. Your blood pressure typically improves, particularly if you have uncontrolled high blood pressure, uncontrolled hypertension. There was less of an effect that was found in someone who doesn't have high blood pressure or who has got controlled high blood pressure, controlled hypertension. So in those patients where you see there is a degree of uncontrolled high blood pressure in the equation, it makes absolute sense to stress by the use of CPAP therapy, you don't only feel better, you will also improve the cardiovascular risk. And this is most likely one of the reasons why in the long term you see the improvement with the effect on benefit in terms of mortality as well.
Thank you. That's really, really useful. And what about any lifestyle changes?
So lifestyle changes in the context of OSA therapy, sleep apnea therapy, are fairly important. They should really be at the heart of any discussion between the physician, the sleep clinic, and the patient. This can be lifestyle change in terms of posture in bed, lifestyle change in terms of diet, weight loss, if that is an issue in terms of obesity. That can be a lifestyle change in terms of stop smoking, stop drinking alcohol, which all impacts either on the airway directly or on how the muscles are relaxed at night time with alcohol, for example. So the latest research in this field is probably very important to mention, relates to patients who have also comorbid obesity with obstructive sleep apnea. And we do now have more and more evidence emerging showing that when you reduce the weight, the load on the upper airway, then also sleep apnea severity improves. Whether it is down to lifestyle, whether it is down to possibly supported weight loss drugs, or whether it is down to bariatric surgery in the more severe cases of obesity. We do see that with a reduction in weight of more than 10% from baseline, the sleep apnea severity significantly improves. And typically, with very substantial weight loss, also frequently may actually resolve.
Thank you, Joerg. So many patients struggle to adapt to PAP treatment. It can be pretty difficult. Are there any effective non-CPAP treatments on the horizon?
Thank you, Lucy. CPAP therapy, as effective as it is, you're absolutely right. A lot of patients do struggle to use it in the long term. A year on, about half of the patients who should be using it may not. And therefore, non-CPAP therapy, as it is summarized, is incredibly important. Now, as tools for non-CPAP therapy, there is to be mentioned something that is called a mandibular advancement device. You bite on it at night, it advances the lower jaw and keeps the airway open. And in mild and moderate sleep apnea, this is highly effective as well. Then there are other treatments, from weight loss therapeutic drugs over the use of electrical stimulation, something called hypoglossal nerve stimulation, either with an implantable device or transcutaneously, non-invasively. And then there are more experimental studies testing also other drugs. Other drugs that try to either focus on keeping the activity of the upper airway muscles running whilst you're asleep, or to modify the drive to breathe at nighttime, like, for example, carboanhydrase inhibitors. And there was a study last year testing the use of sultiam and how it impacts on sleep apnea severity and how patients improve with their nocturnal breathing indices and symptoms with it, published in The Lancet by Winfried Randerath. And so there is more to come. Non-CPAP therapy has not got all the evidence that CPAP therapy has yet, but there are some promising angles.
Thank you. It's really great to know that there is more out there and more treatments are being developed. So obstructive sleep apnea, it's more common, but there are also people with central sleep apnea. And I was just wondering, has there been any recent research in this area?
Thank you. Yes, over the last year, certainly to mention in the context of central sleep apnea, two statements. One by the American Academy of Sleep Medicine, the North American Society in the field, and one by the European societies, the ERS and the ERS, with a statement on adaptive servoventilation. So central sleep apnea is frequently treated also with continuous positive airway pressure therapy, CPAP therapy in the first place. Only that this may not entirely control the problem. And then, what then? So the use of something called adaptive servoventilation, which is a clever algorithm that has a certain pressure and then phases in as the body stops to breathe, with something that is more like a pressure support, and makes the patient breathe despite the lack of drive to breathe at night. That is something that can be considered. And the statements on the use on adaptive servoventilation are so important because about 10 years ago, a lot of these treatments were halted after the publication of a study that showed you may have actually adverse outcomes when you use adaptive servoventilation and treat central sleep apnea. So one moved away from using this treatment. Now, with new algorithms, new devices, and also a more cautious approach to select the patients for whom this may be useful, also, for example, checking on their cardiac function and treating comorbidities. These statements are quite important to show that, yes, you can offer more than just CPAP therapy, and yes, you can also do this safely so.
Thank you. That's really helpful to know. Thank you, Joerg, for taking the time to explain the new research and other treatments that are on the horizon. It's super helpful to know. Thank you.
Wonderful. Thank you, Lucy. It's been a pleasure to talk to you. Thank you.